So I'm Angie Beauchesne. I am a general pediatrician with Primary Health Medical Group, and I want to talk to you today about immunization refusal, which is something that all practitioners are seeing a lot more of. A couple quick facts to get us started on this. There is some good news and there's some bad news. And the good news is that over 99% of children have received at least one vaccine. The bad news is that we're seeing increases in the rate of refusal. And it turns out that in the Pacific Northwest, we're in an area of the country where that's more common. So when you look at 2009 data from the CDC and you look at which state had the highest immunization refusal, what you're going to find is Washington State was the highest with a little over 6%. Some more recent data actually puts Alaska at a little higher than that. Who has the lowest rate? It turns out that it's Mississippi. And the reason that you're going to find that at Mississippi is they allow refusal for only one reason, and that's if there's a medical indication. And that's very different from most of the Northwest states, which allow a personal exemption for philosophical reasons. When you look at other states in the region, particularly Idaho, you get about 3.8% off of that same data, and you'll find a lot of the other states running close to 4%. So what we have is some really nice data that was collected within this last year in the state of Idaho that's very specific to what's causing immunization refusal in our state. And the bulk of this work was really done by Tracy Barrett and Andy Noble from our Idaho immunization program. And I want to start by describing the work they did and the information that they collected. So what they really wanted to do was to figure out, why do parents choose to exempt their children from the required immunizations for entering school at kindergarten or first grade? There were three parts to this. First of all, Tracy went out and she took all the immunization exemption forms from the 2010-2011 school year and reviewed them, and that was just over 1,000 pieces of data. Then what she did is send out about 450 surveys to parents whose children were entering. Half of them were entering kindergarten, half of them were entering first grade. It was almost exclusively public schools, to question them about their beliefs on immunizations. The third part was that the immunization department conducted focus groups early this winter where they specifically got parents together and they talked to them about their motivation and their feelings around immunizations. And so these groups were recruited through mass mailings, commercials, print marketing, and they had about 22 focus groups with about 160 participants total over the course of this. So when we go back and look at the first data, Tracy's looking at these exemption forms. What are the reasons that we see parents exempting their kids from immunizations? Well, about a third of them have fears. They don't believe that the vaccines are safe, they're not sure how they go together, and they're not sure that the benefits really outweigh the risks. About 20% just want personal control. It fits with their philosophy, fits for their religion to not get those immunizations. And interestingly enough, 16% reported that a family member or a family history of a severe allergic reaction to a vaccine, which is significantly higher than what's reported through the National Vaccine Program. So when we look at the geographic distribution of people that are refusing, what we see is there are really two places geographically in the state of Idaho where the immunization refusal rate is much higher than represented by the number of students that are in those districts. And where we see that is in the north, in Coeur d'Alene in the Sandpoint area, and we see it again in the eastern portion of the state, Pocatello, Idaho Falls area. You may see a little bit higher than normal immunization rate in the central area of the state, but most of them are right about on target other than those two areas, which has some implications depending where you're seeing patients and where you're practicing. Then when Tracy did her survey, she collected some demographics. So about 90% of her respondents were mothers. You can see there's some annual gross income issue there. But probably the biggest thing was that 97% of the respondents were from English-speaking homes. So we didn't do a good job in that capturing the minority population. What she liked is that 91% were immunizers, and her immunization refusal rate of about 4.5% really fit with what the rate is or was in the state at that time. However, what I would say is that, again, for a lot of the illnesses, you have to have 95% completion rate to keep those illnesses out of your community. So even though 91 sounds pretty good, it's not going to help you when certain illnesses really crop up in your community. So she asked them what were the sources of influence that they perceived when they were making decisions about immunizations. So they did really feel that what their healthcare provider said was important. And what you see is that a quarter of people actually had no recommendation made by their healthcare provider about what to do. But those parents that were advised to get vaccines were much more likely to go ahead and get them. 50% of the parents really said that friends and family influence a lot of how they make decisions. And the last piece was really the internet. And here we're not talking about like cdc.gov or AAP type websites. We're talking about all comers. And what you see is that overall, a third of people are relying on those kind of websites. And it goes up to about 50% where you're talking about the people who are likely to be exempters. So overall, what she found is about 95% of parents feel that vaccines are important to prevent disease. Drops to about 85% when you're talking about safety. But a third of all parents really continue to have concerns that too many vaccines are given together, that they think we should be more concerned about safety, and they really have questions about whether children would do better to wait starting immunizations till they're older. So then when Andy went and did these focus groups, they were really able to identify 3 different types of parent personalities. One are the pro-immunizers. And again, that type of parent is a very consistent personality across groups and across the state. There's an anti-immunization policy, and in the same way, very consistent type of personality and decision making. And then there's a group they labeled vaccine hesitancy. And this is a really variable group, and this is probably the one where we have the biggest chance to influence the type of decisions they make. So when you look at the pro-immunization group, they tend to do this. They think they're protecting their children. They think it gives them peace of mind. They think it's a good thing to do. They think they're protecting the community. And they think that there's a lot more benefit than there is risk. This doesn't always apply when you get to HPV and influenza vaccine. They don't tend to be interested in what celebrities have to say about these things. They really trust and believe in their child's physician. But they're not really information seekers. So they may not be your best informed parents. They may just be doing it because it's the thing to do and they don't have any overriding concerns about the immunizations. The anti-immunization parents, they don't like a lot of things. They choose not to immunize their children because they don't believe they're safe. They have concerns about it being involved with the federal government. They also tend to have concerns about the government, and you're not changing their mind. The vaccine hesitant parents, though, are interesting. They tend to, by and large, immunize their children, but they may be more concerned about it or apprehensive or cautious for a variety of reasons. Definitely, we see the same vaccines, influenza vaccine and HPV, are cropping up as ones that they have less of a comfort level with. They also are more likely to want a modified schedule or delayed schedule, and this concept of motherly intuition comes up several times in talking with these families. So I think one of the things that I was most struck by when I first saw the data is this bold item. These people feel bullied into immunizing by what we're doing. We think we're out there trying to really protect kids and protect the community, and our families feel like they're bullying us. In general, they're going to choose to vaccinate. They believe that immunizations are really powerful, that they've done a lot of good, but they still have some concerns about the schedule. They tend to believe in CDC and health and welfare, but they're skeptical about how well the supervision is from the Federal Drug Association. The other thing is that there are a lot of concerns, again, about the influenza vaccine, and what you need to know in this group is 90% of the time or more, the mothers are making the decisions about these immunizations. So when we presented this Learning Collaborative for the first time, we asked the teams here to do a group survey activity about immunization refusal in their clinic. And hopefully you will take that outline and go back to your clinic and discuss that with the members of your team. But I wanted to share with you how this group of clinics, which are fairly representative of clinics around the state, answered our questions. We had 8 participating clinics, 5 pediatric, 2 that are family medicine, and 1 Indian health, and they are split between that higher group up north in the Panhandle in terms of immunization refusal and the Treasure Valley, which is pretty much the baseline rate for refusal. So the first question we asked was there a written policy? And the easy answer is nobody had a written policy that was clinic-wide about refusing immunizations, but about half the clinics did have some provider-specific policies about refusing immunizations in their clinic. We asked what was the definition of refusal, and that was all over the board. So one clinic had no definition. Another clinic defined it only if parents refused all vaccines. About half the clinics defined it as refusing some or many vaccines. A quarter of the clinics said it could be any vaccine that they refused. And another clinic said they only called it refusal if the family permanently said they would never ever get the vaccine. So quite a bit of variety. Then we asked, are people terminating refusals? And about 3 clinics of the 8 were, and about 5 weren't. Some of the different reasons that we saw was one clinic uses a vaccine refusal form, and if people were not willing to either vaccinate or sign the refusal form, then that led to them being eliminated for the clinic. Another group was looking to get people started on immunizations by 5, and so they were getting rid of patients if they did not start their vaccines by kindergarten age. When we asked about who chooses the schedule, if you have an alternate schedule, only in one case did the clinic have the family do it on their own. In the other 7 clinics, it was some combination of the providers working with the family and coming up with a collaborative schedule to continue to immunize. We asked all the clinics whether they had an immunization refusal form, and what we found was that 5 of the 8 did have and asked for that to be signed regularly, a quarter didn't, and one of the clinics used it sometimes. When asked which form they were signing, it was a variety, including there's a state, Idaho, immunization program refusal form, there's the American Academy of Pediatrics refusal form, and then some clinics had their own. When asked about whether they had parents sign this periodically, one time, every time, most of them really didn't answer us, but one of the clinics made a point to say that they asked their families to sign it every time because they think it provides a really good opportunity to re-talk with the families about their choices on refusing immunizations. One of the concepts that we wanted to encourage people is using the V64 code, which lists all the different reasons why a family or a provider might not give an immunization to a child. And so we asked clinics if they were using this code, and we got an answer that only 3 of the 8 knew about this code and were using it. Not always in a consistent way either. For the 7th question, we asked if they set particular timetables for families to start immunizations or get their immunizations completed. And what we found was that was inconsistent as well. A quarter of the clinics had a very specific plan, a quarter didn't, half were kind of in between, and most people sounded like this was something that they thought they needed to do a more consistent job with their families about. Lastly, we asked a question that had been asked in my clinic, which is, what is the risk to my child in your clinic from families that don't immunize? And I'll let you read through what the variety of answers are. There's no perfect answer for this, but again, I think you want to know, how would you honestly answer this if the families in your practice were going to ask you about this? So then what do you do? How can you be more effective in this time of increasing immunization refusal? The nice thing is we have some best practices according to some of our national groups. So one of the things is really take time to listen to what the parent concerns are. Neither all science nor all anecdotes work, and most parents actually want to hear both, some of your experience and some of the science behind it. And that's a measure that's actually validated by the CDC. The other thing is to solicit and to welcome questions, so asking permission to immunize their child versus asserting, we're doing your child's immunizations today, really makes a big difference in whether they accept those or not. It does help if the physician or provider is available for the discussion, and it does help to provide the resources. And you definitely would like to keep the conversation going. So what if families go ahead and they refuse anyway? Both the AAP and the CDC recommend not dismissing patients from the practice. They would like you to keep them in and continue to work with them. You do also want to impress upon the families that they have a different set of responsibilities if they're refusing immunizations. They do really encourage using an immunization refusal form. That's particularly the American Academy of Pediatrics. It serves as your documentation that you've discussed the risk and benefit of immunizations with the parents in your practice. And then use of the V64 code or other documentation in the record can help in a variety of ways. It identifies those families so that you have more opportunities to talk to them about whether you can start or give any immunizations. It allows staff who's talking with them to think, do I need to bring this family in the back way? Or providers who don't normally see them, do I need to think about illnesses that I don't normally think about because they haven't been immunized? It also allows better data to be tracked in terms of why they're refusing. And so I do want to just show you the variety of V64 codes. It technically is vaccines not carried out. There are a whole host of reasons. It allows you, if the child is acutely ill, you can use that one. Some of us have some immune compromised patients that really it's contraindicated to get the vaccine. Same way in terms of patients that are allergic. But you'll find yourself using this V64.05 quite frequently, which is the parent, guardian, or caregiver chooses not to give the vaccinations. But make sure that you're using that 2-digit code when you're reporting it. And it's a code that if you're reporting it among your diagnoses can be picked up by the insurance company as well as your billing department. In summary, here are some questions I'd like you to ask yourself after listening to the lecture. First of all, if you didn't have a chance to fill out the immunization refusal survey, please do that with your team from your clinic. Also, think about and list several reasons that you think that immunization refusal is increasing either in your community, in the state, or nationwide. Also, take some time to look at the odds ratios for immunization refusal by the different areas in our state. Look at your community and ask yourself, does this really fit with what I'm seeing in my day-to-day practice? Think about some ways and strategies that you could use when you're addressing and dealing with vaccine-hesitant parents in your practice. Again, that's the most influenceable group, if you want to put it, that you have a chance to actually really change their mind. And lastly, pick and list one of the best practice strategies that you've seen in this lecture that you're willing to try for the next month or so in your practice to see if that makes a difference when you're working with the families that are refusing the traditional schedule of immunizations. This concludes this particular learning session. This would be a great time to work with your practice team and identify some areas to focus on and make changes for the future. Thank you.